Thanks so much, Daniel. It's great to be here. I'm Ellen Lupton, and welcome from Baltimore, Maryland, where I'm located. Where are you today, Bon?
I'm about an hour drive away from you in Philadelphia.
All right, so not so far away. And we always feel close because we're always doing projects together. And our favorite project is this book, Health Design Thinking. So let's get it started. So Bon, tell us how we got started together.
I met Ellen in New York City when we were on a panel at Columbia University. A lot of people ask me, why did a graphic designer and a physician co-write a book together? It's an unusual combination. I was a fan of Ellen Lupton when I read her book, Beautiful Users, because that book helped me to think about how to apply design to healthcare. There are two fields that don't normally intersect. And what Ellen's book did for me was make design accessible. I do not have training as a designer. I work in an emergency department, or you call them an A&E out there in the UK. And I have been obsessed for the past 7 years thinking about how to apply design in the healthcare space. We're going to go old school here. Next slide, Ellen. So I really believe that medicine is both a scientific and a creative endeavor. I do not believe in this false narrative that goes on that some people are born creative and other people are not creative. The people who are creative go into creative fields like the arts and music, and they become painters and filmmakers, while the uncreative people go into boring fields like medicine, like me. Unfortunately, the way that we have designed the pedagogy in education for medical schools, it doesn't promote or invite creativity. In fact, I felt that a part of my creative soul died during medical training. And I had been on this quest to think about, how do we create a platform to allow medical students, future doctors, to apply their creativity and imagination to the healthcare space? Because I believe that to become a better doctor, that requires for us to use our creativity. Next slide, Ellen. So in order to foster creativity in medical education curriculum, we started the first design thinking curriculum in a medical school. And what we wanted to do was get medical students to start thinking like designers. One aspect of design that I really appreciate is this tolerance for ambiguity, and also the ability for designers to visually communicate. And there's a ton of skills that I feel like we can add to a doctor's toolkit by embracing human-centered design in traditional medical education. Next slide.
Bon, can you tell us what the students are doing?
Oh, yeah. Okay, great. Thanks, Ellen.
It looks like they're playing a game or something.
This was a design workshop that we did with architects, thinking about how to lay out the floor plan of a medical surgical unit at the hospital. Rarely do we get to think about how we design how do we design or inhabit the physical spaces in hospitals and clinics. So this was a great way for medical students to work with architects on reimagining healthcare spaces. Thanks for that, Ellen. Next slide. So I've been exploring this intersectionality between medicine and design. And what we really needed at my hospital was a physical space to test out those ideas. So I founded a group called the Health Design Lab. It's a research group in the hospital where we apply human-centered design to tackle tackle real problems that we see in the healthcare space. I like to think of our lab as a sort of test kitchen for the hospital, And we've been creating all these new recipes in healthcare, everything from using 3D printing. I have some back here, 3D printers for surgical planning, and running design workshops with patients, with nurses, with physicians to improve the experiences that we have as patients, to improve the efficiency and delivery of healthcare. So we were collecting all these new, or we were inventing all these new recipes in healthcare. And I felt that it was important for us to collect all these recipes in a cookbook. I don't know how to write a book. I have never done so. So I reached out to Ellen back in 2018 when we were on that panel and said, you write a lot of books. Do you want to write one on healthcare with me?
What an interesting evening that was. I had just finished a book and I was between projects. So Bon, you really lucked out, because if I'd met somebody else that night, we wouldn't be sitting here today. So I'm a graphic designer. I'm also a writer, and I put those two skills together to create books that invite people to engage in being designers. So some of my books are for college level designers, some are for working designers, some are for everyone, DIY kind of books. And when Bon told me that he had always wanted to write a book about design thinking for healthcare, I was like, wow, that's an audience I would love to work with and reach. And between the two of us, with Bon's expertise as a doctor running a health design lab, and my ability to translate that into a form that people can engage with and enjoy, what an opportunity. So why not? So we did it, and it was a lot of fun. A lot of working online, a lot of being far away, but a lot of trips on the train to get together and look at stuff in his test kitchen, where we're seated right there. So let me walk you through what this project is all about, and we'll share some of the principles of health design thinking with you. So what we did is we took the lessons that Bon was developing in his lab with his students and colleagues, and we boiled them down, as he said, into recipes, into principles, methods, and case studies. And we synthesized the literature of the field of design thinking, which is an established area inside of the bigger field of design. And we took those principles and applied them specifically to problems in healthcare in order to speak to people working in that field, including doctors, designers, medical students, pharmacists, researchers, architects, product designers, graphic designers, experience designers, this incredible mix of people who are engaging in this area. And so let's look at some of the principles of health design thinking. So Bon mentioned a few times the phrase human-centered design. And some of you might be sitting there thinking, like, what's that? I mean, isn't all design human-centered? I mean, if a designer creates a building or a chair or a fork or a spoon, isn't it created for human beings? And that's true and not true. So design actually has many centers. Some design is driven by aesthetics, or by a profit motive, or by a political idea. And some design is geared towards what human beings need. So let's look at an example. These are two amazing designs from the collection of Cooper Hewitt Museum. And on your left is a design for a doorknob. and door hardware for a door, inspired by, get this, what music sounds like. So this is a very aesthetic idea, beautiful, intellectual, artistic. The drawing is beautiful. The finished object would be beautiful, made out of beautiful materials. Note, however, that that door handle is round. And round door handles cannot be operated by people who can't grip firmly, by people with a missing limb, by people lacking upper arm or wrist strength. Okay. So a lot of people can't use that doorknob, even though it's very, very pretty. So on your right is a device for upgrading a round doorknob into a lever operated doorknob, which can be used by people with diverse abilities, or someone carrying a baby or a bag of groceries. And so you might notice in your environment that many, many door handles now are not round. They're created with this lever style in order to be more, get this, human-centered. And so this wonderful device allows someone who lives in a place with round doorknobs to change their own environment and make it accessible. And that's human-centered design. So let's see how that might be applied to designing medical devices or services in an emergency department. So here's a question I have for all of you to think about. Have you ever had a gynecological exam in the A&E? Is that what we say? A&E, in the emergency department. Now, I know half of you are immediately going to say, I don't even know what that is. The other half of us are like, I'm not sure I want to do that. Bon, how about you tell us, what's it like to give a gynecological exam in an emergency department?
So emergency departments are very busy. Often we struggle with the intense volume, and we don't have the most optimal conditions to perform exams like this one. This exam actually requires a specialized bed to make the patient more comfortable. So when we don't have that specialized gynecological bed, what we end up doing, it's a design hack, is we take a bedpan like this one and we flip it over to allow the physician to perform the exam. But many of us feel terrible
by elevating the pelvis. Right?
Elevating the pelvis.
I just want to speak to those in the audience who do not have vulvas and uteruses, so they can kind of imagine what it's like to have your pelvis suspended in air so that someone can look inside. And not a position any of us are dying to be in.
And it's dehumanizing to put them on a bedpan like this.
Yeah, so a group of your students in the health design lab set about to solve that problem and to create a device that clinicians could use in the emergency room to elevate the pelvis of patients, and to do it with a device that would be low cost and that would also lie flat when not being used. Because emergency rooms, I mean, every time I've been, I'm just shocked. There's just stuff piled everywhere. Like there does not seem to be enough storage for all the equipment that you need. And so this device, it can't be big. It has to be something that disappears like a notebook or something. And so the device is called Tilt. It looks like this and is a really wonderful product designed by a team of your students. What makes it human-centered? Well, it's dignified. It creates a better experience for the patient. It creates a better experience for the clinician, who is also a user of the product. It's low cost, so it appeals to the people running the hospital or the health service. And here you see members of the team prototyping this device. And you might wonder, why is this dude doing a gynecological exam? Why is he being subjected to this? And so part of the idea of empathy in the design process is to put yourself in the position of the patient. So every person on Bond's team had to get the exam, even if they weren't women. And that is human-centered design, right? Having to experience what the user experiences to the degree possible. We know that's often a fiction, right? And then in our book, we look at some wonderful case studies of things that designers and architects and doctors and patients have created to improve healthcare. And here's one of them, and it answers a research question. How can signage reduce violence and aggression in the emergency department? So it turns out there's a lot of violence in these places. And often that violence is triggered by people's frustration with not knowing why they're waiting. So Bond, can you tell us anything about people getting angry when they have to wait in the emergency room?
Sure. I just worked in the emergency room last night, and patients were getting upset because of the long wait times, and then a question of what is next. It's very chaotic. And I love this example of how graphic design can improve healthcare, because it takes away that sense of a lack of control, because it gives a patient the steps in their journey in the emergency department. And often the staff don't have time to tell the patient what's exactly going on. By looking at these simple elements, they could go, okay, here is this step of my journey. Here's what I'm going to anticipate next. So it's that uncertainty that drives fear, that can drive anger in patients who are at the worst time of their lives, being in a hospital.
One of the things I learned from you, Bon, is that the waiting is actually part of the care. And so when you go to the emergency room, the A&E, the caregivers need you to stay for a while. It's part of an observation period of making sure that you're stable and that the problem has actually been solved. This was a revelation to me, and I can't believe that nobody ever told me that. Right. So as a patient or taking my children to the emergency room, I would just be mystified. Why is nobody talking to us? Have they forgotten us? Right. So I would be the annoying mom that would go out and like find the nurse or find the doctor. And if someone had just given me a piece of paper or put sign on the wall telling me that waiting is part of the process, I would have felt less anxious and perhaps less violent. Right. What's great about this solution, this design, is that it is very low cost. These are vinyl signs that can be printed anywhere and put into the facility at very low cost. And the designers thought of things like putting signage on the ceiling so that a person lying flat can get this information and understand what's happening. So health design thinking doesn't have to be expensive. It's not high-tech gadgets. It's not VR headsets. It's not futuristic. It's often very, very simple, and maybe even feels obvious once it's been done. This is a beautiful case study from our book. It's called PillPack, and it's now owned by Amazon Pharmacy. And so imagine that all of your prescriptions, instead of coming in 20 separate little orange bottles, come packed together with simple text telling you what time to take it. And so your 8 a.m. pills are in a pack and your midnight pills are in a pack. And what a great service that simply takes something that people already are doing, which is getting pills from a pharmacy, and changing the way it's delivered. So it's service design, it's package design, and it's experience design. We also have projects in our book that are created by patients and have the perspective of patients. And it's really important to recognize patients as part of the creativity of healthcare. This is a project by Molly Bonell, a designer who is chronically ill with cystic fibrosis. And so she spends a lot of time in hospitals. And one of the dehumanizing things about hospitals is the clothing that you have to wear. And so she designed a system and approach for customizing your own clothing to make it friendly for receiving IV treatments, for example. And she had to work with the nurses to find out what would make this clothing convenient for them. Because basically hospital gowns are created for the nurses, not for us, right? They have to be easy to get in, easy to get off, in and out, whatever you have to do. And so she really had to bring into account their needs as well as the patient needs. And that's a really beautiful human-centered design process. This project called Visual Health History is by Katie McCurdy, who's a graphic designer who is also chronically ill. And one of her experiences in the healthcare journey was having to explain over and over again to new caregivers what her symptoms were, when their onset was, what else had been happening in her life, like the loss of a child or other kinds of traumas that had gone on in her life. And she had to keep telling the story over and over again as she sought a diagnosis for her conditions. And so she developed this beautiful graph that would allow her to speak more clearly and more vividly with her doctor. And the doctors loved it and said, you should do this for other people. And she turned it into a business where she helps patients articulate their story through information graphics, and using tools like these to help patients articulate what they're feeling, what kind of pain, where, through very vivid terms that are more effective than just a 1 through 10 scale. So Bon, our book came out, the first edition, in March 2020. And we were so happy. We both got a big box of books, and we had all these invitations to go lecture at different universities. It was going to be fun. What happened, Bon?
Well, let's go back to that time. It was a dark time for all of us, especially here in the US, because SARS-CoV-2 had come into the East Coast of the US. So next slide. I work in a hospital in Philadelphia that's only 90 miles from New York City, which in March of 2020 was the epicenter of the world of the pandemic. It was tragic. Almost 19,000 New Yorkers died within a 3-month time span. What I learned from working in a hospital is that good design can save lives, but bad design can kill. And why did so many New Yorkers die in such a short period of time? We did some post-analysis of this. I met with leaders from emergency departments across New York City, and we were thinking about how could we have prevented this catastrophe? Was there a way? Was there something special about New York City because of its density, because it's a world capital, that the virus spread so rapidly and killed so many people in a short amount of time? These were all contributing factors, but one of the main reasons why so many New Yorkers died was it was a problem of the design and the system of healthcare systems in New York City, that they had this inability to load balance.
And it might be helpful for people in the UK to understand that we don't have a national healthcare service. We have separate hospitals. Sometimes it's a group of 7 or 8 or 10 hospitals that are like a corporation. And then in the same city, there might be 3 or 4 other corporations with 7 or 8 or 9 hospitals. And that's how the New York hospital network works.
Exactly.
And they're all like separate businesses.
Yep, separate businesses. And so if you were a patient who got COVID, you ended up going to the hospital nearest you. And what happened was certain hospitals got overwhelmed. A nurse can only take care of 1 or 2 critically ill patients who are on ventilators. But during the height of the pandemic, a nurse was caring for 5, 10, 15 patients on ventilators. As a result, many patients died because certain hospitals got overwhelmed, and we had a system that could not load balance between hospitals. So that was a little depressing, but good design can save lives. Good design can protect. This is a picture of used N95 respirators and PAPR masks that I actually wear in the hospital. This is actually my office in the hospital. I had this customized ritual where after I worked a shift in the emergency department, I would save the N95 respirator just in case there was another supply chain disruption. So I love the N95 respirator. It's my favorite design object in healthcare. It has prevented me from getting COVID in the hospital. And what's amazing about this device, this medical product, that in its history, there was actually an American industrial designer who actually helped invent this N95 respirator, working with the 3M company. Next slide. At my hospital, we use technology like 3D printing to respond to supply chain disruptions. Back in the summer of 2020, we were in danger of running out of those nasopharyngeal swabs that we all had stuck deep in the back of our nose. It was crazy that we were running out of these little sticks. And that posed a danger for the public, the healthcare system, because if we couldn't test, we couldn't hunt down the virus. So there was an amazing research group out in Florida who open sourced the 3D printing files for us to 3D print nasopharyngeal swabs. So we converted my lab, the health design lab in the hospital, to in-house manufacturing facility where we're able to 3D print 35,000 swabs for reserve. And we're able to do that in a matter of weeks and quality test them. Next slide. Rapid prototyping allowed us to be nimble. The virus was constantly changing. So our therapies and our protocols had to change. Here is a picture of my colleague using an airway shield that's made out of plexiglass. We were testing this early on in the pandemic to protect us when we're doing the most dangerous procedure, which is an airway intubation, because it aerosolizes the virus. And I believe what we need to do in healthcare is to have safe ways to rapidly prototype. And what this does is this reduces the barriers to innovation. And we've seen during the pandemic some of the amazing creativity and new technology that happens when you can reduce these barriers, when you can prototype quickly. We have the mRNA vaccine, which I never believed could be designed and invented within a year. Extraordinary. I hope in the future we can learn from what happens when we can quickly, rapidly prototype new life-saving therapies. Next slide. But I want to emphasize that medical technology and devices alone it's insufficient. It's not going to we can't just rely upon that alone. Physicians, public health officials really need to design for trust. A lack of trust has led to this virus of misinformation and disinformation. I still treat patients who are still not yet vaccinated. During the pandemic, there were varying rates of the levels of vaccinations in communities. What we did when we started designing a pop-up COVID-19 vaccine and testing sites is we implemented a principle that we talk about in our book, this principle of co-design, of treating the end users as experts. So in this case, the end users were the communities in which we were testing, in which we were delivering vaccines. So from day one of the process, we had listening sessions with community members, with organizations, with companies, with churches and schools, to learn about their needs, to develop empathy for their situation. Not all people in a community could go to a mass vaccination site. There were certain people like immigrants or people who were undocumented who were working 6 days a week, and they did not have time to go to the vaccination site that was within the central part of our city. And it was more convenient for them to go to a site within, it was walking distance within their own neighborhoods. Next slide. So what I love about our second edition of the book is that Ellen had collected all these stories of creativity. People all over the planet were innovating, and we feel that our book can be a sort of a field guide for rapid response design. I'll hand it over to you, Ellen.
Yeah, so really, as soon as the first edition came out, Bon and I started working on the second edition. And at the time at Cooper Hewitt, I started organizing an exhibition about design and the pandemic. And it was a kind of wild thing, because you think of museum curators looking at 2,000-year-old artifacts, or pouring through libraries of, yellowed pages looking for, this ancient history. But this was curating on the fly and paying attention to what new ideas people were bringing into the field as it was happening. A really different way of working than I have usually worked. And so here's one of the ideas. So Bon, you showed us that N95 mask, which the design hasn't changed in over 50 years. So you love that mask, and yet we don't have enough of them. They're not sustainable. They're really uncomfortable. Why has that design never changed? And so what the pandemic did is it prompted people who never thought about masks to come up with new and interesting ideas and to put them out into the marketplace. So this is the Essential Mask Brace, designed by Sabrina Paceman, an engineer. And her concept was to take a low-cost surgical mask that kind of fits loosely over your face and to create a stretchy silicone brace that holds that surgical mask tight against your face. Because that fit is what makes the N95 more effective than a surgical mask. It's because it is fitting closer to your face. The prototype was inspired by some rubber bands tied together to just create this thing, right? And then, it's very carefully engineered. You'll see these little kind of comb-like fingers around the nose, which are there to solve the problem of that fit against, the human face, which, boy, don't we wish it was a beach ball, then all this would be so easy to design. But the human face has such a complex geometry to it. And so what makes this a better design? Well, it's more comfortable. It's low cost because the surgical mask is cheap and you can keep reusing the brace. And you're throwing away less material. It's still a disposable product at the base, and that sustainability in hospitals is a real problem. But it's been shown that this blown textile with an electromagnetic charge is the best way to keep the virus out of your airstream. And so we have a product that's cheaper, more comfortable, and more sustainable. That's kind of great. Amazing it took 50 years to get there. 50 years and a pandemic, right, to inspire it. Here's another design. This is from a fashion designer in Bulgaria. And I can guarantee you, Katya Lozanova never designed a face shield before this pandemic. Probably never heard of it. I know I hadn't heard of it. And she asked the question, how could we make it look cool and be comfortable to wear and be not like a thing strapped to your head, but actually to move freely with your body? And actually, I think I'll demo this because I'm wearing one right now. So how about we do a little demo? Okay, here's my face shield. What do you think, Bon?
I love it. It's cool. I think you still need to wear a surgical mask under there, though.
Oh no, that's going to ruin the fashion. So face shields, they're not 100%, but they do protect people from viral particles being splashed into your eyes, which is pretty cool. I'll go back to my slides now and show you this really incredible story from 2020. So while the pandemic is unfolding, the United States is also experiencing our 2020 presidential election. And these two events have some friction with each other. A lot of people want to see, a change in our government in 2020. And one of those people was Dr. Alistair Martin, another emergency physician working in Boston, Massachusetts. And he was struck by the demographics of the community that he serves, that many people who use emergency departments are low income and don't have any other source of healthcare. And many of the staff in hospitals are also low income. And these people have a higher likelihood of not being registered to vote. So in the US, there's a whole process for getting your name in the system so that on voting day, you can actually vote. So he thought, here I have this community coming into my facility, and and they're sitting there waiting, right? They're there for hours. He thought, what if we use this opportunity to encourage people to vote, to make it easy for them to register to vote? So he designed this little kiosk that holds an iPad, a tablet, and on the tablet is some software that allows you to go to the website where you can register very quickly and easily to vote. A lot of people don't know, where do they do this? How do I register? And then there's a piece of graphic design stuck on the back, right? A cute, fun, happy sign that says, register to vote here. Okay. Brilliant idea. Brilliant, human-centered idea. However, as the pandemic unfolded in the same historical moment, it became less appealing for people to touch a screen. And so he came up with a new idea. And the new idea is an ID card on a lanyard with a QR code on it. And hospital staff, doctors, nurses, social workers, techs could register to get this lanyard, and they could interact with patients and say, hey, since you're waiting, would you like to register to vote? Or patients could ask them, what's that? What are you wearing? Tell me more. And so essentially, Dr. Martin replaced a technology-based solution with a much more low-tech solution that's cheaper and that really relies on human interaction and that could be rolled out nationally. And so he simplified the process triggered by the pandemic, right? By this problem of touching and people being afraid to touch screens, and came up with a truly brilliant and superior service design. So I just love it when the good design is actually cheaper, easier, and more human. I want to talk for a minute about data graphics. Data graphics have been essential in the fight against COVID-19 because we can't see this pandemic if it's not visualized on graphs and maps. And it's easy for people to wish it away and say it's not there. Private individuals and institutions have led in the United States the creation of data graphics tracking COVID-19. So universities like Johns Hopkins University, news organizations like the New York Times, they have created the data that is used around the world by policymakers, by medical experts, epidemiologists, and everyday citizens who want to know what's happening. The map on the left may be familiar to some of you as the famous map by Dr. John Snow, who set about to prove that cholera was transmitted by water, not by air. And he used dots on a map in order to collect his evidence and to visualize his evidence. I'm going to show you a 1-minute video clip from a longer piece about data graphics that appears in our exhibition at Cooper Hewitt, and these ideas are all in our book, to just show you how the very simple idea of dots on a map is such a powerful way to make an invisible pandemic visible. Data graphics use basic design elements to show what the eye can't see. Dots on a map help us see geographic patterns. In 1855, Dr. John Snow tracked cholera on maps of London. He discovered clusters of cases around a water pump. These maps proved that water carries cholera. This interactive map by ProPublica explores Cancer Alley, an area near New Orleans. The region is dotted with hundreds of chemical plants and oil refineries. Residents in this predominantly Black area suffer from many chronic diseases. New plants are still being built here, despite the known risks. Levels of toxic particles are shown in shades of pink. These high levels of pollution are associated with higher death rates from COVID-19. Wow. So if you thought that graphic design is just making things pretty or showing you where the toilet is, graphic design is saving our lives. And the people creating those graphics are essential workers, in my view. And let's talk about a couple of medical devices. This is one that was designed in northern Italy during the first wave of COVID-19, where northern Italy was another ground zero for this pandemic. And a couple of engineers met with a doctor who advised, couldn't we take an ordinary commercial, not a scuba mask, a snorkel mask, and add a valve to the top that would allow the mask to be hooked up to oxygen delivering technology. And so that yellow element at the top of the mask is a 3D printed part that can be printed anywhere in the world. It can be easily modified to fit the snorkel masks available in that region. And it has been downloaded thousands of times and enabled healthcare facilities to deal with supply chain disasters and get equipment that they needed at points of crisis.
Great. I'm going to talk about the beginning of 2020. There was this fear that we were going to run out of ventilators. I want to do a demo that illustrates that fear and what we did to respond to it. So when you have a severe COVID pneumonia and you can't get enough oxygen into your lungs, a life-saving thing you could do is to connect a patient to a ventilator. In order to do that, you have to use this tube, which is an endotracheal tube. And this won't be a Royal Institution lecture without us doing a demo. I'm not going to insert it in my mouth, but you can see that you put this through your oropharynx, it goes through your vocal cords, and it goes into your trachea, and then you hook this end part to a ventilator. So if you don't have a ventilator, you can't do this, and you're not going to get enough oxygen into the lungs. So we thought, why is there a way that we can have volunteers act as human ventilators? And you can actually do that. This is a bag valve mask here, and it delivers, you hook it up to oxygen, and you could deliver breaths to a patient. You can connect the bag valve mask to the end of the endotracheal tube, and you could press about 12 breaths per minute. And so a human volunteer can actually ventilate a patient who requires an endotracheal tube, and you actually don't need a ventilator. Of course, this is a doomsday scenario that none of us want to do, but that's how dark it was in the beginning of 2020. So what if you don't want to act as a human ventilator? What can you do? And I want to illustrate this device here. It is a rescue ventilator. I'm going to turn it on. And what it does is it replaces your hands with these mechanical hands. So this was created by a group from MIT, a group of mechanical engineers, and a company called 10X Beta based out of New York. And they were able to respond very quickly and come up with this device within a matter of months and gain emergency use authorization. So if you can see, these are actually mechanical hands that can compress a bag valve mask. You could change the rates. You could actually change a tidal volume and deliver an ideal amount, a customized amount of oxygen to a patient. So what you do is you get the bag valve mask, you put it in here, and that could safely ventilate a patient. So you could walk away. And this is very low cost. This is about $2,000 as opposed to a hospital grade ventilator, which is about $60,000. So we saw this group build 2,000 of these, and they are used as a backup reserve for New York City right now. So we saw groups all over the world create rescue ventilators like this, so we could connect a patient to oxygen and safely ventilate them without risking ourselves getting the virus. Okay,
That's amazing. And another feature of that product, Bon, is that Mario Bota, the industrial designer, wanted it to be possible to manufacture it in New York City.
Yep.
So that's dealing with that supply problem. And he was successful. These 2,000 ventilators were manufactured in New York City. Which
right in New York
we
City.
don't make much in New York anymore. Yeah, so let me pull the slides back up. And there's Bon demonstrating this technology
you can skip
on
over
an educational
the
video, which is really cool. And here, I think this plays. Yeah, you can see these mechanical hands operating that ambubag. So, and there is a history to this. You may think it sounds absurd that this manual ventilation could be done for more than a few minutes in an ambulance, for example. But actually, the first large-scale use of any kind of positive pressure ventilation was during a polio outbreak in 1952 in Copenhagen. And many children were affected. This outbreak happened very quickly. And these young people were suddenly, many of them paralyzed. Your diaphragm becomes paralyzed and you're unable to breathe. And they did not have iron lungs available. So medical students, nursing students, and dental students were brought in to do this manual ventilating for days and kept hundreds of children alive. And this actually helped launch our modern use of ventilators as ongoing life support. They'd been used during surgery before, but not for extended periods of time. And something I really want to point out is that although these technologies look very kind of bright and cheerful, including this one, which is not a ventilator, it's a mask, right? It's a step before you become intubated. The experience of these technologies for patients is traumatic. It is really a terrible experience, and one that some people do not survive from. And I want to show the technology that preceded positive pressure ventilation was the iron lung, which was used at mass scale during the polio pandemic, and which uses a different technology to ventilate the lungs. So when you breathe, and everybody's probably needs to breathe, when you breathe, you're using muscles to expand and contract your chest, right? Your lungs have no muscles. And what an iron lung does is it changes the pressure around your body. It puts your body inside a vacuum, and it changes the pressure from positive to negative and causes your lungs to expand and contract. There's no tube forced down your lungs, down your airway. You don't have to be in a coma. You don't have to be sedated. You're not in pain, right? You're simply, your chest is opening and closing. And this technology gave birth to the ICU. That's what an ICU basically is created for, is for people that require breathing support. And this technology is being brought back. And so engineers in the UK and in Bangladesh have been developing a modernized iron lung in response to the pandemic. The thought, why couldn't we bring back this more humane form of ventilation? And so what you see here is a working prototype for an iron lung manufactured in Bangladesh, where in a country of 60 million people, there are 350 ventilators. And this technology has the potential to change healthcare in South Asia. And it is a more humane experience. So you see on the left, a patient in an iron lung reading a book. Bon, have you ever seen an intubated patient read a book?
Never.
Not possible. So in an iron lung, you can read a book, you can drink liquids and eat food, you can talk, you can look at a telephone. You need assistance, but the experience is more humane. So I'm going to end on that. You can come to our exhibition and see this iron lung for real. And if you're exhausted and overwhelmed by the experience of creativity in this terrible pandemic, you can relax in this beautiful room in our conservatory, designed by two wonderful designers in New Delhi. During the pandemic, they wanted to create something warm and fuzzy and huggable. And they installed these beautiful cushions in our conservatory. And I invite you to come and visit us in New York City. And thank you so much.